I'm going to talk about engaging policymakers and funders of research and emphasize the who, why, when, for what purpose, and this is going to be the outline of my presentation. I don't have to read through it in the interest of time. And I just picked one definition out of several definitions. What is a policy? And it will be a plan or a course of action or a set of regulations adopted by government, businesses, or institutions designed to influence or determine decisions or procedures. It's so general because it's embraced in schools. I don't want somebody to say that it's policy is only in health, policy is only in economics. It's as long as you have a plan of action, a course of action, a set of regulations, this could be termed a policy. For instance, you can have a research policy for the institution, which could talk about which research is done, who does research, how they do research, how is it regulated. So it's a policy, it's a course of action. And policy engagement usually refers to a proactive process. Now, I want to answer what one of my colleagues, Dr. Campbell, asked that. What is the university doing? At the moment, the university has a policy that, for example, for PhD students, and even encouraging master's students to write a less summary, so that other than your technical report in medicine or pediatrics, you write a less summary. What is it that you did? And it's encouraged that all people who graduate have it. And even for the PhD, before you graduate, I think you read a summary of your work written for a lay person, for the journalists. So they encourage you to practice before you go on to defend. So that's one way. And it's one of the requirements now that should be part of your thesis. So I think from there we shall go a step forward to say you even go ahead to the proactive process. So policy engagement is a proactive process involving concerted efforts by researchers to stimulate, establish, or foster dialogue between themselves and policymakers. And the aim is to ensure that results of research are utilized by different stakeholders in policy making. So there are several stakeholders when it comes to research. The stakeholders could be the funding agencies, could be the researchers, could be the policymakers who utilize the results of research, could be even the innovators who take the products to the market. For instance, research on malaria, you find a product that a certain protein can be made into a test, a lab test, maybe for rapid diagnostic tests. Then innovators can take on from there to take the product to the market. So all those are different stakeholders. And all of us include the lay public and the media, who many times we use to communicate research results. So all these are different stakeholders. So anybody involved in that process of taking research to the public to be utilized that active process is policy engagement. It may also refer to the process of interacting with the funding agencies with the goal of policy development. And we are going to see in the next slide, maybe in another one, why this is important. Policy engagement is very important because the gap between research and practice and findings is very big. There is a lot of research that has been generated. The principal said that a lot of research is generated every year by the Makerere University, but many times we don't know what that research is because it ends up as dissertations. And it's important to engage those people in positions of influence to ensure that this research, this information that's generated can inform policies. So some people call it evidence-informed policy making or evidence-driven policy making. But also it's important to encourage policymakers to act in the public interest without imposing measures that will have a detrimental effect, so that now the researchers who generate the information can also have a proactive process of trying to find out what is happening and the policies that are meant to serve the community, how effective are they, how are they performing, so that in the public interest, policymakers are required to carry out activities that will benefit the lay public, all of the lay publics. And also because the policy making process and also development is dynamic, you need to provide insight into operations of a given policy in line of changing evidence. For instance, recently there was a change in malaria policy. But now you find that in some countries like Malawi, they have resumed using chloroquine because they find that it's now, after some time, it's effective. And even for the drugs now currently being used, like ACTs, there's evidence of resistance here and there, sporadic, but may reach a point when it becomes significant. So you find that you need to go on providing evidence to change the policy or to improve on the policy as time goes on. Now, when you consider policy engagement, you have to consider the context. And the context refers to all the factors, the surrounding factors in the decision-making process. It includes the stakeholders or players and their roles in policy engagement, as well as the methods that they employ. These include the donor agencies, the funding structures, the socio-economic and political situation in a given country, but also includes the media, the civil society, who implement the policies, and the lay public, who, all of us are lay public at some point, who eventually are the beneficiaries of this policy. Now, there is an important issue which Dr. Beza talked about, that are we asking the right questions? It's important that researchers interact with policymakers so that you identify priority research questions as well as priority policy issues, so that you need to also identify the intervening steps. For example, when you talk about malaria, who is involved, who is affected, how are they affected? All these are important priority research questions before you carry out research on any given issues. And policymakers may be crucial in the research planning process, in that researchers need to participate with policymakers to formulate the questions. But that's not the most important thing. You need to formulate the questions, but also see how you are going to collect the information, who is going to use the information, and how that information may affect the eventual, the population. So all these are very important, and it's for this reason now that in many institutions and many organizations, there is call for multidisciplinary research, so that as you design your research questions, different people can come in and advise you, can contribute to the questions from their own professional background, from their own expertise and experience. They can contribute to research questions. And also it's encouraged nowadays that if you are going to carry out a research, you can as well publish your proposal, and many journals, for those in academia, many journals publish research proposals. And the reason is that you can put your ideas in the open and people can critique them even before. For example, many other cities have to, it's recommended. And if you're going to write a proposal, to write a systematic review, you're required to write a proposal so that people can critique those ideas even before you go to the field. But you can also engage the other beneficiaries by maybe talking to the lay people, to the policymakers, even before you embark on your research. Now, research users are very important stakeholders, and decision makers are more likely to utilize results if researchers identified the users. So you need to identify who is going to be the beneficiary of the research results before you conduct the research, so that they could also have an input in the way you design your study, the way you implement the study, the way you evaluate the interpretation. Sometimes you can have the results, but the way you interpret them may be from a given standpoint. For instance, you may be biomedical and you talk like a biomedicist, if I can say something like that. Or you may be a social scientist and you reason like a social scientist. Or maybe from public health and you balance the two. Or you may be from the political side or economic side and you are interested in cost. So all these are important so that as you conduct the research, you think of the different stakeholders and they can have an input in your study as you design it. Then there are important mediators. These may be individuals or institutions, organizations, which actually foster linkages between the research generation and research utilization, and may act as brokers to link the research generation to policy development. And sometimes we need to evaluate or synthesize the evidence first for credibility or feasibility or priority or sustainability before you give it to these people. For example, the media are very important mediators. And the media are vast. You can have those from the print media or from the broadcast media or the performing groups. They all can be able to communicate this information which you have generated from research, but they need to communicate it because they have different audiences. They need to package that information to suit the particular audiences. And so this refers to also another important factor in the environment, the product. The studies themselves and how they link up to the decision-making process are very important part of the product. For instance, if you're going to write a systematic review, and you want policymakers to utilize it, how will they understand unless they know the basics of a systematic review? You may need to give them an evidence brief or some other form of communication which they can understand. And sometimes people go on to conferences and say, oh, there are many policymakers. I think they have taken up the message because you went like the last conference for the college. No. They might go there just to interact with their colleagues, and you write your paper with a lot of evidence in terms of p-values, relative risks, but they don't understand the message. So you need to write something which they can understand and be able to comprehend. So the next important thing is the message. What do you have to say? And this message needs to be relevant to the different stakeholders. So that they need to be able to identify with it, see that it's of value to them, and so they need to be involved in the planning stage of the project. So even as you plan, you need to have an idea of what likely results are likely to come from, what results are likely to come from your project, so that you can be able to have an idea of how your results are likely to be utilized and who is likely to be affected by the results. And so if they are affected, how are they likely to behave, or what will happen after you have talked about the results? So the message is also very important. And before you engage, you need to ask yourself, why is it important for policy development for you to carry out policy engagement? You need to be able to sum this in a few sentences for yourself and others. So you need to think clearly through your messages to say, is it important and what is it that you are talking about? Make sure that you know what you want to achieve by engaging with policymakers. So you don't just say, I've engaged with policymakers. What do you want them to do? Is it to change policy? Is it to reflect on the policy? Are they plan to change it? Is it to entirely divert from what they are doing? Or is it to evaluate the existing policies? So you need to be sure that as you communicate, you think through what you want them to do. And then you need also to think about who has the power to make a difference. We need to identify the key individuals. There is somebody from Parliament. Those people are very important as much as the people of the district, local councils. Because once you don't involve them in the decision-making right from the start, you can have your good results, but they end in paper, maybe in good publication and be promoted and so on, but they not translate into policy development. Of course, it doesn't mean that the policy change depends entirely on research results. As we shall see, there are so many players. But for them to tell the results, you need to link up with them. You need to link up the media, the civil society, any professional association. For instance, if you are doing a lot of work related to maternal and child health, and you leave out the Association of Gynecologists, or you are doing a lot of work on children and leave out the Association of Pediatricians, then you may not get support for your work, even if the results look good. That just because you didn't involve an important stakeholder group. You also need to think of other stakeholders like think tanks, NGOs, charities, or international governance organizations. These also contribute a lot to policy development. Now, when do you engage these people? The most effective stakeholder engagements are upstream. That is, right from the beginning, as you conceive the idea. And nowadays, you are encouraged as much as possible, publish whatever idea you have. Go to a conference. Many conferences have free discussions, free communication. Air out your idea. If it doesn't make sense, they will just say, hey, that man has a problem. Or has ideas, but is ahead of his time, of the time. But at least you air out your views, or you can publish them. And many journals allow publications of just ideas, without, even if it's not research. And of course, when they call for the grand challenges, many of you know them, you just want those ideas, innovation, so they can be published. And usually you can. So what I'm trying to say that should be upstream, right from the start when you have an idea, the planning stage of research. And as you go on generating the research, you can go on communicating with the different stakeholders. For instance, organizations like Virus Research Institute as they go on generating data, they communicate, they call the media, they call press, they give out press releases and media interviews. They call for media interviews, and they communicate this information even before reaching the final result. They might say, this is work in progress, work is ongoing, so that they get in feedback from the different stakeholders at different stages of the research process. And finally, when you get your product, the research, you can also engage the different policymakers. So where do you engage them? Now, politicians are usually very busy people, and many people in civil society are busy, so they have other competing interests. So you need to identify this. If you are going to be proactive, you need to indicate it in your project that there will be, and nowadays many funding agencies, for instance, Wellcome Trust, National Institutes of Health, encourage, actually they don't fund you if you don't have a dissemination plan, which includes also some bit of policy engagement. How are you going to communicate this information so that it informs policy? So you need to identify these people and have a budget for dissemination, for policy engagement. And you may need to make sure that you may have to look for the different stakeholders in their own places for you to be able to effectively engage them. And so how do you engage them? If your project is significant, you may find that you need a very large scale meeting of policymakers and professionals. You may use a workshop format. And sometimes as the process goes on, you may use different formats. For instance, you may, an institution like Infectious Disease Institute can call, organize a media interview, have like a press conference, or they can issue press releases, and in that they invite different policymakers and engage them. Or it can organize a large-scale meeting and engage the different stakeholders. And nowadays there are so many online, can be very effective. For instance, you can use Twitter, you can use Facebook, you can use LinkedIn, and so many others, so many. So you can use all these as a powerful way to reach out to different policy communities. One way which has been there for a long time and well tested is to have dialogue meetings. If you want to have a successful meeting with policymakers and other stakeholders, you need to get a sense of the kind of event, what is most likely to work. You present your findings. You may present them like a lunchtime seminar or a half-day meeting. And make sure that you think of the different issues they are likely to ask, or you can even ask them for the likely questions beforehand. So that if you go to present the results, maybe you present a press release first, then you go on to have a large-scale meeting, and then there you discuss the issues in detail. And then find out the ideal time for your target audience. I think these are details which you may have to cover in the panel discussion, so I don't want to go into details about them as to how you can do it, but just to say that you need to avoid, you can't have an engagement of policymakers for 3 days. It's impossible. They won't have time. You need to give them, to make sure that you package your engagement in the shortest possible time that is effective, and half a day may be ideal. And you need to focus on your audience's needs. Don't focus on presenting your very high power results. Find out what the different stakeholders may want to hear, and also state the audience benefit for the event in your promotional materials. Why is the meeting there? What is your work? Why is the meeting important for those people? Then they are more likely to reflect on the results and utilize them in their policy development process. And the meeting should be dialogue, so that you give them a chance to react, to raise their concern, to provide their perspective. And so if you have time, a workshop format is better. You just present a few results, they discuss, they come up with the different opinions, and you present all the opinions. Or you may just have a briefing format, whereby you just have a short communication and an interactive discussion, like over a lunch seminar. And we make sure that there are appropriate materials such that they can be able to have more, those interested can have detailed information about your work. And so you may need to go with a journal article or a one-page summary on top of the work. Now, the other way of engaging the different stakeholders is I was told it's called evidence brief. I'll call it from now on evidence brief. So these are a number of different terms for policy brief. So there are a number of different names used, but some people call them briefing paper, briefing report, briefing note, or research brief, but they refer to the same thing, that's a short document that summarizes the project or research findings and the policy implications of that research. And there are a number of conventions that are used to write a brief. For example, the ones I have participated in here with SURE, I think there are 2. They are quite big, but though they say that it should be as not more than 25 pages, that's the full report, but you can have a summary of about 4 pages and an executive summary of 1 page. But sometimes you find documents which are bigger. So the main message is that they are the same, that the main section should have the key points first. And then you have an introduction, the findings, and then another section that is usually written in bold are the policy implications, or which includes the take-home message. So there's a part which should be for methods, but make them as simple as possible. And then you can also just refer to them in the document so that an interested reader can go on and find the detailed methods elsewhere. Or you may just summarize them, but make sure that you write them simply in lay terms. And from the outset state that you're just writing an existing research, you just give the brief aims of the document, and then present that information in the context of all the existing evidence. Don't present your work as if that is the only work that exists. For example, you have done research on maternal health, maternal mortality, and you think your work is the only work available. There is so much ongoing and already published. So your work up to that present time when you present it should be presented in context of all the information that exists, and explain the content both practically and conceptually, spell out clearly and carefully why you have found this important. So that in a few words, why do you think your work is important? And why do you think it will influence policies? And how will it influence the policy? And then how does it add to what is already known? You present what is known, what you have presented, what you have added, what influence it's likely to have on the existing policies. So focus your policy relevant findings and recommendations to just the work that you did. Don't generalize and say health workers, because you looked at maternal mortality in Mulago Hospital being high, you say in our country we should have theaters everywhere. No, focus your policy relevant findings. Just like you do a scientific publication, your conclusion should be on your objectives. Likewise, your policy recommendations should be focused on the work that you did. Highlight them, and this should take the most steps. Now, this is the details about, but I think we could leave them out because we're going to have a panel discussion. But just to summarize that, you need to make it like a document that people are likely to read. So make sure you use appropriate tables, charts, and graphs where possible so that you don't just write text. And make sure you use appropriate statistics to provide evidence. If you have a qualitative research project, make sure you use appropriate quotes so that people can get the true perspective of the project that you are doing. And the names and pseudonyms and other details, sometimes you may need to put them so that if I say, what name is not in Uganda? Dr. Mwangi, I don't think there is a Mwangi in Mulago. Dr. Mwangi said, people will reflect that and say, one doctor said. So these are details which we may discuss when it comes to the panel discussion. And then policy recommendations should be very clear, specific, feasible, and realistic. You may include references, usually 5 to 10, but like I said, this depends on the format you use. Sometimes you may need to put as many as possible, and then attribute authorship, and then there is also another form of engagement, which is a policy dialogue. These allow research evidence to be brought together so that you can call a meeting of different researchers and research users and all the important stakeholders together so that they can talk about their views, their experiences, and then how they are likely to be affected by the decisions of their research. So that's one form of a policy engagement. So they enable interaction between the different people, and they can identify which factors are associated with improved use of the research evidence in policy making. So as they discuss, they come up with how that research can be utilized to improve the policy or to change the policy, so that a policy dialogue is also one important form of policy engagement. And it has had a lot of interest, especially in the last 20 years. And you need, the reason for this is that there is need for locally contextualized decision support for policymakers. For instance, you may have a policy on maybe HIV, but that policy may be generated by World Health Organization, but it needs to be taking care of the local context. So a policy dialogue is very important so that the local players, different civil organizations, the patients representatives, health workers can come in and contribute to the policy by looking at the results as they are presented. And research evidence is only one input into the decision-making of process. So there are so many other factors. So one important consideration is that you need to know that other factors are important other than the results that you present, and many stakeholders add significant value to these processes. This is one way of presenting it when you compare a policy dialogue and a debate, in that there are so many, they are worlds apart in terms of objective. A dialogue, once it's collaborative, you want common ground, you want to enlarge perspective, you want to search for agreement, you want people to reflect on what they do, and you want to look for strength, you want to evaluate assumptions, you listen for meaning. So it's open, so that every person's idea, as long as they're in the dialogue, every idea is important. Unlike in a debate where usually want to win, the ideas win. So a dialogue is more of inclusive rather than what happens in a debate. So then questions which one needs to ask themselves about if you are going to organize a dialogue, policy dialogue, does it address a high priority issue? How do you know something is a high priority? For instance, the number of people affected, who is affected, where are they affected, how often are they affected, what are the implications of their being affected, or is it grounded in the priorities, say, of the country, of the institution? For example, in the Kaye College of Health Sciences has a research agenda. Something that is related to the first 2 or 3 ideas is a priority, is a high priority issue. You may find that this priority was developed from the priorities of the Ministry of Health. So priorities of the Ministry of Health also, you find that if something is high priority, then it will be suitable for a dialogue. Then you need to discuss the options for addressing the problem and the key implementation strategies. And you need to ask yourself whether the dialogue is informed by a pre-saturated policy brief, so that people already have an idea of what you are going to present in the dialogue. So usually you saturate either a policy brief or a very short presentation before you call people for the dialogue. Okay, this is what we're looking at in terms of priorities on the government agenda. All stakeholders think it is very relevant, and the agenda needs to look at the problem, the options, the implementation considerations, the possible next steps, so that you don't leave people hanging with good results. They need to know what next. And then you need also to consider whether you looked into the requirements of the different stakeholders, the different interest groups and external factors, so that all these contribute to the dialogue.